Flexi Overdenture, non-coping direct technique. Place the Flexi Overdenture template over an undistorted radiograph. The post selection should allow 1 mm of lateral root structure remaining at the most apical placement of the post, with the post fully seated. Once the appropriate size post has been selected, the matching EDS Gates Glidden drill or piezo reamer is used to remove the gutta percha from the canal. For matching size selection of drills and posts, see the illustrated chart in the instruction booklet. A rubber stop is used to maintain the proper depth of the post hole preparation. All EDS Gates Glidden drills are color-coded to match both reamer and post size. When 100% of the post hole and 90% of the width have been achieved with the Gates Glidden drills, the primary reamer is inserted into the canal until the shoulder contacts the coronal dentin. It is best to limit the number of entries into the canal to once or twice and to always cut wet. The countersink root facer drill is used next to create the spaces for the second and third tiers of the Flexi Overdenture. Within moments, you will have machined the perfect seat for the Flexi Overdenture. It is important to note that the countersink root facer is not self-limiting and can be used to further deepen the dual preparations if needed to provide more clearance for the overdenture post and cap. Please observe the well-defined countersink and root face preparation. Flexi Overdenture post is now trial seated by inserting it with the overdenture wrench. If resistance is felt, back off half turn and then advance. This removes dental debris from the thread line. Never force the Flexi Overdenture post. If the flange of the post is not fully seated within its preparation, the post must be cut. Shorten the post apically enough to allow full seating of the flange. Use a fissure burr or diamond stone to shorten the post, making sure to cut both legs at the same time. FlexiFlow or FlexiFlow Natural in shade Vita A3 fluoride-releasing composite cement is now mixed and placed into the canal with the Lentulo spiral. The Lentulo will deliver the cement to the bottom of the post hole. In addition, coat the shank of the post to assure a complete cement interface. Post is then seated in place. The Flexi Overdenture vent releases hydrostatic pressure and the cement acts like a lubricant, allowing the placement of the post virtually no stress or strain to the root. Incorporation of the nylon attachment cap. It is important to first place the rubber band on the head of the post. If the rubber band is not in place, there is a risk that cold cure acrylic could lock in under the post head, making the denture difficult to remove. The female nylon cap is now placed on the ball of the post. As an added feature, we will continue to show this procedure with the new and improved Easy Change Keeper and Cap Insert System, which may be purchased separate. The Easy Change is a patented metal keeper and nylon cap insert system, which allows for quick and easy cap insert replacement when worn. It requires only seconds to replace a chair side. The keeper and cap insert system may be used in place of the standard nylon caps to facilitate easy replacement of worn cap. Place the Easy Change Keeper containing the cap insert on the head of the Flexi Overdenture post. Mark the Easy Change Keeper with marking paste or spray. Place the denture over the ridge and remove. The marker tells you where to relieve the acrylic in the denture. Repeat this procedure until the denture fits passively over the keeper. Place pink cold cure acrylic into the relieved portion of the denture and place over the ridge, and let set. Make sure the rubber band is covering the height of contour of the head. If not, there is a risk that the cold cure acrylic could lock in under the head, making removal of the denture difficult. The rubber band is now removed and the flash trimmed. The overdenture is now ready for use. Easy Change cap insert replacement when worn. The Easy Change insert cap may be replaced by inserting a two-pronged Easy Change wrench into the worn cap insert and unthreading it. Replaced by threading in a new cap insert. This procedure is completed in seconds. The Flexi Overdenture titanium post may be used in the indirect coping technique as well as the previously described direct non-coping technique. Following segment will demonstrate the indirect coping technique. Follow the same procedure for post hole preparation as the direct technique until completing use of the primary reamer. The secondary drill is used to create the second tier preparation in the coronal post hole preparation. When doing the indirect coping technique, a 0.5 millimeter space is needed between the flange of the post and the coronal tooth structure to allow for the placement of the coping. To achieve the 0.5 millimeter space, seat the post completely and then back off half turn. The post must be fully seated before backing off half turn. If the post is longer than the post hole, remove enough apical post length to allow the post to seat completely. After achieving proper post seating, take an impression of the trial seated post. Please note that the post is not cemented in at this point. Remove the impression from the post. Remove the post from the canal and temporarily seal the canal. Send the impression to a dental laboratory along with a corresponding sized brass transfer stud. You may or may not insert the stud into the impression. The laboratory places the transfer stud into the impression, pouring it up in stone or plaster, and then waxes up and casts the coping with a hole in it to accommodate the Flexi Overdenture post. When the coping is returned from the laboratory, it is trial seated, and while still in place, the Flexi Overdenture post is also trial seated. Cement the coping using patented FlexiFlow or FlexiFlow Natural in shade Vita A3 fluoride-releasing composite cement. Before the coping has completely set, use a Lenchulo spiral to place additional cement into the canal, coat the shank of post, and fully seat the Flexi Overdenture post. Post insertion is completed when the flange is fully seated within the coping. The excess cement is removed, and you are now ready to insert the nylon cap or easy change attachment as previously discussed.